It's really the flexibility to identify challenges within the current healthcare work environment and then be able to work with teams in fixing those problems. And this results in two very important outcomes: the improvement in patient care and being able to help create a work environment for nurses, which allow them to take the ownership in their practice and be able to deliver that care. It is interesting that in the last two national surveys of infection, hospital-acquired pneumonia was tied for number one, and now it sits alone in that position. It's interesting to note that 67% of that pneumonia occurring with patients is not on a ventilator. We spent so many years focusing on pneumonia when a patient was on a mechanical ventilator and the impact that that had on time on the breathing machine, time in the intensive care unit, and even mortality. We now have great data showing the impact of non-vent pneumonia, and it's the same. But the clinical focus on addressing it is not. Simple interventions such as 4 times a day oral hygiene or 3 times a day walking has shown significant reduction in hospital-acquired pneumonia. And this really ties into a topic which is referred to as missed nursing care and the impact that that has on patient outcomes. So these clinical issues, I believe, are a manifestation of a larger problem where we may have taken the focus off of fundamental nursing care practices, and as a result, the patient has suffered. Really starting the journey as you enter acute care for nurses and nursing assistants to truly understand the breadth of their advocacy role and its powerful link to do no harm. Then being able to make that connection with evidence-based fundamental nursing care practices like oral hygiene, bathing, and mobility to the outcomes that are being measured as a reflection of the quality of nursing care that we deliver. Skin injuries, functional decline, falls, pneumonia, and hospital-acquired infections. The next step is then to be able to identify processes and products that make it easy for the frontline caregiver to be able to deliver that evidence-based practice with each patient as needed every time. I believe when we do that, the environment changes to make one of ownership, where the clinician knows how to make a difference and they feel empowered to do so. And as a result, the patient benefits.